All right, let's talk about a word you've probably heard a ton: anthrax. And no, this isn't just something from a spy movie. It's real. We're talking about an ancient bacterium that can be turned into a pretty terrifying modern weapon. So, in this explainer, we're going to break down exactly what it is, how it works, and why it's taken so seriously. Yep, you guessed it. The answer is anthrax. What makes it so formidable is that it really lives in two different worlds. On one hand, it's a totally natural disease that's been around for centuries, but on the other, it can be engineered into a weapon with, some really terrifying consequences. So, why all the fuss? What is it about this one little bacterium that has global health officials on high alert? Let's dive in. Okay, so at its absolute core, anthrax is what we call a zoonotic infection. That's a key word right there. Zoonotic just means it starts in animals. We're talking mainly plant eaters like cattle, sheep, and goats. And from there, it can jump over to humans. So it's not really a human disease to begin with. And that potential for harm? That is exactly why it gets classified as a Category A bioterrorism agent. I mean, that's the highest threat level there is. It's reserved for things that can be spread easily and, frankly, cause a lot of panic. The real key to its power, though, are its spores. Think of them like these tiny, incredibly tough seeds of disease. That resilience is what makes it a perfect candidate for a weapon. All right, so let's zoom in a little. Time to meet the microscopic culprit behind all this. So here it is, Bacillus anthracis. Now, if there's one thing to remember here, it's this phrase, spore forming. You can think of it like the bacterium's ultimate survival mode. When things get tough, no food, too dry, whatever, it can basically transform itself into this tiny, hardened shell, a spore. And these things are resistant to pretty much everything. Heat, drought, even disinfectants. It's an absolutely incredible survival mechanism. And check this out under the microscope. When it's active and growing, the bacteria link up end to end, forming these long chains. See how they look kind of like boxcars on a freight train? It's a really distinctive look. And it's one of the first things microbiologists look for. And if you want a real-world example of just how resilient these spores are, look no further. Back in 2016, a heat wave in Siberia thawed out the permafrost. This exposed the carcasses of reindeer that had been frozen solid for more than 70 years. Well, the dormant anthrax spores inside them basically just woke up, and they caused a brand new outbreak infecting people and thousands of reindeer. 70 years in the ice. It meant absolutely nothing to them. So how does this little thing actually make us sick? Well, it uses this really sophisticated three-part toxin. First, you have something called the protective antigen, or PA. The best way to think of it is like a skeleton key. It finds a lock on our cells and picks it. Once that door is unlocked, it lets in the two real weapons, lethal factor and edema factor. And once they're inside, they just wreak havoc. They shut down your immune system and cause all this massive tissue damage and swelling. Okay, but here's the thing. How this whole attack plays out depends completely on how it gets into your body. So anthrax isn't really just one disease. It's more like a disease with 4 different faces. Let's take a look. Yeah, the route of entry just completely changes the game. You can see here the most common form by a long shot, we're talking over 95% of cases worldwide, is cutaneous. That's just from spores getting into a cut on your skin. But the one that gets all the headlines, the one linked to bioterrorism, is inhalational, and it is by far the most deadly. The other two you see there, gastrointestinal and injectional, are super rare, but still incredibly serious. And these pictures, wow, this is the classic unmistakable sign of cutaneous anthrax. It starts out looking like maybe a little bug bite or a sore, but then the center of it dies and turns into the solid black, painless scab. That's called an eschar. It's actually a pretty interesting word. It comes from the Greek for scab. What you're literally seeing there is the toxin at work just destroying the tissue from the inside out. Now, inhalational anthrax, this is what makes it so incredibly dangerous. It has this 2-stage or biphasic progression. And here's the terrifying part. Phase 1 looks and feels exactly like the flu. You get a fever, a cough, you feel awful, but you're probably not thinking anthrax. Then, all of a sudden, you crash into phase 2, and we're talking an abrupt, catastrophic progression to severe difficulty breathing, shock. It's this deceptive start that makes it so hard to diagnose early. And that difficulty, that delay in diagnosis, it's absolutely critical. Because when you're dealing with anthrax, your prognosis is 100% a race against the clock. So let's put that race into perspective. Look at this number, less than 1%. That's the mortality rate for the common skin form, cutaneous anthrax, if you get antibiotics in a timely way. It's almost always survivable. Now, get ready for the contrast. 90%. That's the estimated mortality rate for inhalational anthrax if you don't get treatment. I mean, the difference is it's stark. It's terrifying. And it just goes to show you how deadly this thing is when it gets into your system and is left unchecked. But this is where modern medicine makes a stand. This chart says it all. Look at the incredible difference that treatment makes. Getting prompt, aggressive medical care can cut that horrifying 90% death rate down to 45%. Now, don't get me wrong, that's still a desperate fight for your life, but it turns what was a near-certain death sentence into a real fighting chance. So what does that life-saving treatment actually look like? Well, the good news is we have a very clear three-pronged strategy to fight back. You can think of it as a three-pillar approach. Pillar 1, you hit the bacteria themselves and you hit them hard with powerful antibiotics. But here's the catch. That's not enough. Because even if the bacteria are dead, their toxins are still floating around doing damage. So Pillar 2, you give the patient antitoxins to go in and neutralize that poison. And finally, Pillar 3 is all about supportive care. That means things like ventilators, IV fluids, anything to keep the body's systems running while it has a chance to recover. And check this out. For any exposure that's systemic, like inhalational anthrax, the course of antibiotics isn't a week or two. It's a full 60 days. 60! So why so long? Well, it all goes back to those pesky spores. They can hang out in your body dormant for weeks. You have to keep the antibiotics going long enough to kill off any new bacteria that might hatch from those spores later on. Now, here's a really, really important point that helps ease a lot of public fear. Unlike something like the flu or COVID, anthrax doesn't really spread from person to person. It's just not a thing. You get it from the source, from the spores themselves. And that means patients don't need to be quarantined in that same scary way, and healthcare workers can stay safe just by using their standard precautions. So when we talk about prevention, it's not about avoiding sick people. It's all about controlling the disease where it starts, in animals. Vaccinating livestock, that's strategy number 1, hands down. For people in high-risk jobs, think vets, farmers, wool sorters, using personal protective equipment is absolutely crucial. And if someone even thinks they've been exposed, we can give them that long course of antibiotics as a preventative measure to stop the infection before it ever gets a foot. So if there's one big takeaway from all this, it's this. Yes, anthrax is incredibly dangerous, no question. But it's not some mysterious monster hiding in the shadows. It is a known enemy. We understand how it attacks, we know what it looks like, and we have very effective tools to fight it. And that really just leaves us with one final thought to chew on. Anthrax is a powerful reminder that the threats we face can be both ancient and modern. It kind of forces us to ask a tough question. In a world with all these new emerging diseases popping up, how do we make sure we stay prepared for the old ones? The ones we've known about for centuries that are literally just waiting in the soil?